A concerning situation in Markham. About a dozen people that we know of seriously ill in hospital after a suspected poisoning at a local restaurant, I should say. York Region's Medical Officer of Health, Dr. Pakes, joining us live now with an update on what we are learning to this point. Good morning to you, Doctor.
Good morning.
So let's start with the numbers. We were saying about a dozen that you are aware of. Could you anticipate this number increasing?
So there's about a dozen people that we're aware of who had become ill in some way. Only a small number of those are severely ill. So all 12 of those are certainly not in hospital right now. And I don't really anticipate many more people, at least from that one event at that restaurant. You know, the toxin that we think may be involved is one that acts very quickly. And in fact, you know, most of the people who became ill within an hour, within a couple of hours, or overnight. This happened on Sunday evening. Become ill, you know, fairly quickly. So I don't anticipate that increasing unless we become aware of other patients who are affected who went to different hospitals in different areas. But, you know, that's likely around the number of people affected.
Before we talk about that toxin, can you speak to the patients or those that were impacted at all? Are we talking about kids, adults, or a range?
So I don't really want to share the demographics, the ages, but certainly a few of them are quite ill. And, you know, this is something different than we usually see in the work that we always do in public health and inspecting restaurants and then following up on foodborne illness. So this was very quick. It was a couple of different groups as opposed to just, you know, one group of people. And those people were quite ill. They have been treated, though. And I think part of the good news here is that we did our investigation right away, and we have some ideas about what's going on. We've taken the product off the shelves as far as we know, and we're continuing that investigation. And the patients are doing relatively better. They were, you know, quite severely ill with this toxin, but they got the appropriate treatment at the appropriate time. And my understanding is that they are improving.
Doctor, can you speak to this toxin? And you say this product off the shelves. So what exactly was it?
So, you know, right now we don't have confirmatory testing. And as you're probably aware, there's lots of speculation on Twitter, and several, you know, toxicologists have you know, come on the news and suggested various toxins. But we do think it's aconite or something like aconite, which is a toxin that can be found in various, or in a specific, actually, herb. And you've got the picture there. And sometimes that can get accidentally, you know, I don't believe this is intentional, but that's something for others to figure out. You know, it can get unintentionally included in spices or in herbal remedies, that sort of thing. And it's happened before, you know, back in March in BC, in ginger root, this had occurred. And so we're thinking that that might be what has occurred in this case.
Doctor, I know it's still early in this investigation with public health, and I understand that this restaurant is cooperating. What could be the next steps here?
So yes, everyone involved has been cooperating from the restaurant, the folks involved, and what we're doing now, and our health protection team has done amazing work just over the past 24 hours in, you know, figuring out where this actually came from, where it was purchased, removing it from the shelves. The next steps are, you know, getting it tested appropriately to check what actual toxin might have been in the food, making sure that everyone either throws it out or, you know, if they've purchased it, that they don't use it. And then the next step, of course, would be just finding out, you know, is this distributed more broadly? Is it very local? And that's something we should really know, hopefully by the end of the day, and we'll be communicating that out to everyone.
Okay, great. But to confirm, everyone is recovering, those at least who are seriously ill. But I want to note the restaurant again, Delight Restaurant and Barbecue. But you are still advising those who maybe dined here or did takeout or delivery on Saturday or Sunday, if they're experiencing symptoms, they should come forward and seek some medical attention?
Yes, certainly. If they're experiencing symptoms, and as I noted, most people would know by now, but, you know, a little bit different than the usual numbness or tingling of the tongue, weakness, some nausea, dizziness would be the main symptoms. And people, if they have those symptoms and have eaten there, they should certainly come forward. And I want to emphasize again, this seems very much like a one-off incident as far as we can tell. And, you know, that restaurant is collaborating and cooperating with us. So, you know, I wouldn't want to besmirch their name or anyone else. And we'll have some more information about what people can do to make sure that they're not affected.